Each one of these beads represents a procedure that Alyssa went through during her grueling cancer treatment, including 2 bone marrow transplants. She was the first patient in the world to have a new form of gene therapy, which cleared her aggressive leukemia.
Well, he doesn't want any more surgery.
That was 3 years ago. And this is Alyssa today, age 16 and still cancer-free.
I really did think that I was going to die and I wouldn't be able to grow up and do all the things that every child deserves to be able to do. I went from 4 months straight in Great Ormond Street to now I only come back for medical appointments once a year. So it's really amazing just how much more freedom that I'm able to have now.
Breathe in and breathe out.
In 2022, Alyssa was given donor immune cells, which had been genetically modified using a new technique called base editing. This involved 3 precise changes to the donor white blood cells' DNA, including making them resistant to chemotherapy and stopping them from attacking Alyssa's body. The cells were then armed to fight her cancer. A bone marrow transplant then rebuilt her immune system.
A few years ago, this would have been science fiction, but now we can actually collect white blood cells from healthy donors and use them for their powerful immune effects by reprogramming them and asking them to go and hunt down leukemia when they're given back to patients.
Your recent bloods, they're all good.
The team at Gosh and King's College Hospital have since treated a further 8 children and 2 adults.
82% of the patients that would have been otherwise incurable went into a deep remission and managed to go ahead with a bone marrow transplantation. And at last follow-up, almost 70% of the patients are alive and in complete remission. So given how aggressive this particular form of leukemia is, these are quite striking clinical results.
The speed of scientific progress in human biology and genetics is astonishing. In just a few years, conditions that were previously incurable are now treatable.
So looking through the microscope.
Alyssa from Leicester is studying for her A-levels and can now plan for the future, including how she may be able to help others.
I'm looking into doing an apprenticeship in biomedical science and hopefully one day I'll go into blood cancer research as well. Not just for my type of cancer that I had, but for so many others.
The same technology that saved Alyssa's life has also been used to successfully treat the blood disorder sickle cell disease and may have potential with other forms of cancer.
Fergus Walsh with that report. Much more on Fergus's story on our website. Lots more still coming up here on BBC News, so do stay with us. But for the time being, we're going to